I don't have to do anything, and I can have 3 women here at my feet worshipping me. I don't have to communicate. I don't have to give. We need to see a shift in ethical porn. My girlfriend's not enjoying when I choke her and hit her. I don't understand, because the women on the videos I watch seem to enjoy it. Actually, to be honest, it's probably the worst addiction I've seen.
And I think it creeps into everybody's lives.
At the push of a button, you can be watching the most hardcore graphic images.
This is Between the Sheets by MHC, a podcast about sex, intimacy and relationships. Hi guys, James here from the Men's Health Clinic. Today I'm going to be talking to Nick Brewer, our sex and intimacy therapist. And today we're going to be talking about porn addiction. I hope you enjoy it. Okay, so another topic I want to talk about, Nick, which we have a lot of patients calling us asking for advice on this, is porn addiction, which we've seen a massive spike in porn addiction, of course, since iPhones and what have you, and since that's happened, as you would expect. And I think it creeps into everybody's lives. And I think some people have a healthy relationship with porn, and some people, I realised through, talking to patients, have a terrible relationship with porn. I also think that because I live half the year in Australia, as you know, and you're Australian, and I'm very proud of Australia on the basis that they've banned social media and access to iPhones and what have you in schools up to the age of 16, which I think is they're 6 months away or a year away from doing that. So good on them. I mean, that's a really bold thing to do. Because I mean, the fact that my 14-year-old, 15-year-old son can get hold of that kind of stuff, and I mean, you have your parent locks and things like that, but people can access it, and they'll always find a way. But adult porn addiction is what I want to talk about to start with. And goodness me, I bet you see a lot of clients that are hooked, right?
Yes, I do, James. And it's actually, to be honest, it's probably the worst addiction I've seen. I have worked in drug and alcohol, but porn, because of its very nature of accessibility, as you just mentioned, it's just too easy. I mean, let's face it, if we want to do coke or anything, any kind of drug, we at least have to go to the effort to find a dealer and, source something out. We have our kids, with iPhones, smartphones, laptops. At the push of a button, you can be watching the most hardcore graphic
just
images.
Awful.
So,
I used to have to find a pornographic magazine under a hedge or something when
exactly.
I was a youngster.
It was your dad's Playboy, right?
Yeah.
You'd be lucky if you saw a pair of titties, and that would keep you amused for months. But
it's just awful to think kids can get hold of that stuff.
Yep. And, I do want to address that first. My view on porn is, nothing is inherently bad. To label anything totally bad or totally good, it's just not a balanced view. The answer to bad porn is not no porn, but it's just better porn. But I do, I'm totally shocked actually, but proud that Australia has taken this stand. I know there is going to be a lot of backlash, of course, but I really do promote the concept of these developing brains should not have access to the type of hardcore material that is available, on these.
Robs them of their innocence, doesn't it? And it's not the right impression of life, is it?
No, and I am seeing younger and younger clients at MHC.
Are you? Yeah.
I mean, even 20. We're talking 20 now. These boys already have a 10-year addiction to porn at
sad.
20. No erections at 20 years old. I mean, James, I'm sure you can remember at 20 you were walking hard on, I'm sure.
Yeah, absolutely.
These boys are ruined at 20.
And that's the bit I don't understand, because everyone has a different relationship with porn, but it's always been an aid for myself, whereas some guys, you say that they're 20 years old, they've been scarred by porn, and then they struggle to get an erection. How does that all play out? How does that happen?
Yeah, well, you can imagine, as I just said, if you're used to looking at gangbangs and this, very intense, even violent porn, it has become so normalized. You're actually considered a bit of a freak if you don't watch porn. It's just part of the rite of passage to
So
being
sad.
a boy, okay?
Yeah.
So we live in a society now where it's completely normalized. Now, I actually hear comments such as, my girlfriend's not enjoying when I choke her and hit her. I don't understand
Awful.
because the women on the videos I watch seem to enjoy it. So what we're seeing is these unrealistic expectations.
Yeah.
Also from the girls, maybe they're virgins, they're seeing this stuff thinking they're required to participate in bukakis and gangbangs and all sorts.
I've noticed that with some of my younger friends as well. They talk about, it's about choking the girl at this time.
Yeah.
They're having an orgasm.
Yeah.
I mean, crazy stuff.
Yeah, there's some...
Not real, I don't think. I mean,
And an adult brain, and I'll get on to sort of...
We'll be able to determine the difference.
Exactly. Not to say that they don't get addicted as well, but their brain has already formed. These boys... are very impressionable. Doesn't matter if they're, if it's drugs or porn, but these brains are still growing. So it's
those
being
evil phones.
hardwired. The other problem I see is the unrealistic expectations. We're now seeing VR and 3D porn where boys... It can't get any more real than.
So they end up having a relationship with AI, basically, or a video or something.
Exactly right.
Yeah.
And it's also teaching them to be quite narcissistic. If they're not even developing social skills, and let's face it, our teenagers are glued to their phones. They're not really out socializing as much. It's all about, social media. Then they have this false expectation that it's almost this... I don't have to do anything and I can have 3 women here at my feet worshipping me. I don't have to communicate. I don't have to give.
Awful.
This is now setting them up for their future relationships and sexual experiences. You can imagine.
Dangerous, yeah. And rates skyrocketing, and you can see why it's happening, can't you?
Or even just they get their first girlfriend, and how boring is this?
Oh, yeah.
This is the main concern that I'm seeing. Most men that I deal with in their sort of late 20s, early 30s, they have no libido, no desire for their wife or partner anymore because they just cannot match what these images and the excitement and stimulation are
Completely
offering.
get it. Yeah. As a man myself, there's been moments where I've sort of had a word with myself, and there's things you can do. Like I remember, putting parent locks on my phone and just to break the addiction, because I mean, it happens to the best of us. I mean, I think a lot of men are faced with that.
Yeah.
But it's, as you say, the children don't know how to separate, do they?
And so,
and then they grow up into men, with these false realizations,
Correct. I even had a client who was exposed to porn at 3 years of age. His father was watching the porn and he pretty much was made or was in the room to watch it. So, and he's suicidal now. He cannot perform. He cannot hold down a relationship.
Isn't that terrible?
So, and that is a severe case, of course, but,
You see the whole spectrum.
I do see the whole spectrum.
Yeah.
So porn has a lot to answer for. But as far as I said, we need to see a shift in the way that porn is being used. And that means
So is there a healthy relationship someone can have with porn?
Well, yeah, if we, porn is made for white men by white men, okay? We need to see a shift in ethical porn where we're looking at consent for everybody involved, from the entertainers right through to the production crew, where everything is safe, it's consensual. We have inclusivity. We need to see real bodies, not all plastic surgery, not these massive penises. This is also setting up a lot of
that's going to cause performance anxiety, isn't it? Yeah.
Body image issues in young boys that they see these monster cocks. Sorry, pardon the French, but they see these and they think, well, I'm inadequate in that department. They have no reference point. So
dangerous.
We need to see more non-objectifying women, a bit more respect, maybe even showing things like connection and foreplay and chemistry and pleasure, not just the big 3 that I mentioned earlier of erections, penetration and ejaculations. So, using porn differently.
So porn can be used in a healthy relationship, right? But I suppose both couples consent, and is that how it kind of works? Or explain to me what a healthy relationship with porn is, Nick?
Yeah, healthy porn is about awareness, and this is why, again, everything comes back to mindfulness and awareness. Without awareness, you are just going to be on autopilot, scrolling through the videos.
And like you say, when you have sex, how boring, yeah.
Yeah, so what I encourage my clients to do, obviously if they have a full-blown addiction, we're trying to get them to go off it or abstain from it for a period of time.
So the technique would be, okay, so you tell them to stop doing it for, say, 1 month, would you, or 1 week, or how does that?
We're talking about 3 months.
Are we?
If we're really
you must have to really focus on that.
And we have strategies around that, which I can get into. But back to just how do you watch porn healthily is, for instance, you would, first of all, set an intention. I'm going to watch porn, but maybe I'm not going to ejaculate, or I'm just going to see the effect that porn has on my body. So first of all, you're going to even get in touch with why am I even watching this? Am I watching it because I'm bored, I'm lonely, I'm
releasing stress?
Yeah. So again, we have to even be mindful how we're consuming the porn. Okay. So one of the methods is to choose a video, stand up. Again, we're going for this pattern interruption, building different neurological pathways. So instead of sitting in the chair, hunched over, penis in hand, going for it, we want to create a whole different association. So I would get them to stand up after they have chosen.
With their partner or without their partner?
No, this is alone.
Alone,
okay?
yeah.
All right. Let me just address that. If partners want to watch it and it's consensual, and because it can be helpful to explore certain desires or fantasies
within
together.
the relationship.
Exactly.
Yeah.
If we want to go down a BDSM pathway, I don't want to end up in some dungeon being flogged without perhaps
understanding and
dipping my toe in for a minute. So once again, it can have a positive role to play within couples. But as far as the men that I treat, to get them to view it in a healthy way, I would get them to stand up, start watching the porn, not masturbating, so they have to watch it and start to become aware of what's happening in their body, okay? Because
normally it's just straight in, whereas they're feeling
hand on
it.
Penis. Yeah. So they have to stand, be aware of what they're feeling. Okay, they're aroused. As soon as they start to become aroused, they have to stop the video, not pause it, so they can still see the still image.
Yeah.
They will turn it off, go and lay on the bed, and for 3 to 4 minutes, just touch themselves, not in the way to get themselves to ejaculate, but just to feel that energy, be with themselves without the porn. Just 3 or 4 minutes, stop, get up, put the video back on. By this time, they're probably going to be more aroused, but no hands. Just going to be watching and noticing. Am I getting itchy? I want to touch. You see how we're going back to really noticing what is going on in the body.
Definitely. Versus
getting lost in the wank.
Definitely. Yeah, no, I get that. Okay. And I think, again, something else has just occurred to me that, certainly growing up, with masturbation and what have you, guys, they had to do a lot of deep thought and thinking about perhaps a sexual experience or whereas it's just now solely image, isn't it? That deep thought masturbation's kind of gone, really, hasn't it, really? So, and that continues into adulthood, like you say. So,
and that is another avenue. Does it have to be so visual? Can we listen? There's a lot of erotic stories and,
which is perhaps another technique,
Exactly. So getting so much less visual and more of the audible sensations involved.
Might cut that addiction a little bit.
A little bit, yeah. But then also I like to, with my clients, use the McDonald's culture versus the Michelin star experience.
Explain that to me.
Yeah. So again, we live in a society where it's, on, rush. Everything is just do it without even thinking. As I just mentioned, maybe I just need to masturbate every night to get to sleep. It's become a habit that I don't even think about. This is that McDonald's culture. We want the quick fix, the instant gratification, low nutritious meals. And I liken it to, I use the metaphor, the same way you would drive through a McDonald's drive-through. So you roll up, the dopamine is starting to, thinking about the food, same as we're scrolling through the videos, we're scrolling through the menu on the drive-through. We're picking what we want to watch. We're picking what we want to eat. The
algorithms are suggesting. And
correct.
So addictive.
Correct. We pull over in the parking lot. We don't even, eat in. We just pull over. We devour this, useless, non-nutritional
Well, I've noticed actually on social media, you suddenly come across a reel and I saw one the other day and this girl was sitting at the bottom of some steps by the sea, Mediterranean somewhere. She had sort of a sort of night dress or something on and she was shaking a bit, but someone went down and said, "What are you doing?" And she was masturbating right next to it. But, young people or, adults see that and they think that's normal, don't they? And it's just so not normal, is it? I mean,
exactly. So, we see this, consume the McDonald's, we throw the garbage in the bin, same as there's the quick release of the masturbation, toilet in the tissue, versus, and this is, again, the paradigm shift, like what about a Michelin star restaurant? You're not going in there paying $400, euros to get out of there in 3 minutes. It's not about just the food. It's about the experience. It's about the wine, the atmosphere, the ambience, everything. Now,
so if you make it part of your sexual routine with your loved one, then it can be quite healthy.
Or alone, a self-pleasuring exercise where you lay down and essentially you might light candles or even just listen to music, but you take your time to masturbate, to edge, make the whole thing
an event
rather than that quick
McDonald's
fix.
Got it. That makes a lot of sense.
And guys were like, they just don't think like this. They've never been asked these questions or had these conversations, and then as soon as you do, they're like, actually, Nick, now you mention it, this is kind of exactly what I've been feeling.
Actually, I read a review from somebody that wrote to us the other day talking how amazing experience it was with you, and it was a couple, and he was heavily addicted to porn, and there was no sex in the relationship, and now they're just back together. They've reconnected. What happened there? That's just insane. That was brilliant. Well done.
Yeah, and again, I've learned a lot through talking to the men, but I see patterns. I'm starting to see patterns in age groups, and these younger guys who are the most heavily addicted, early 20s to early 30s. What is happening is, as you mentioned before, they're not actually in relationship with their partner. Porn is their relationship. Wow. Okay?
Gosh.
So it's not, and when you think of it like that, all their needs are met by porn. They don't have to communicate either with their wife. It's easy if she's putting some pressure on that I can just go and do this. I don't have to talk to these women. I can have whatever I want. It's a very easy solution. So when we put strategies in place to get them off the porn, maybe we can talk about those strategies in a moment. But once they do get out ahead of the porn and revisit the relationship with their partner, it's quite interesting. They go
reset, really, don't they?
It is a reset, and I see the same pattern happening in that they, from becoming libido-less, without the porn, suddenly they become hyper aroused by their partners.
Wow, that's amazing. That's what the gentleman was saying that wrote to me,
Yeah, even just going to the shopping mall, they might see just a nice-looking girl, not even half undressed like you see a lot of women, no judgment, but, even the type of outfits a lot of, women are wearing, everything is very sexualized. But even seeing just a pretty face or just a nice outfit, these men are starting to get their erections back because we've got rid of the porn, and it's like being a virgin again almost. It's like everything's
rediscovering
exciting.
themselves. Yeah.
And then, of course, their partner becomes super sexy again, and they almost go the other way. It's very interesting, and they all follow this pattern.
Brilliant.
And
so good.
They fall back in love with their partners. So there is a definite pattern to this stuff.
It's so wonderful when I read the success stories. It's fabulous. And some of these men, I mean, you'd think they'd be quite shy about giving us reviews, but we're very proud of our reviews. Thousands upon thousands of 5-star Google reviews, and a lot of them mention your name, which is brilliant, Nick. So we love what you do.
Thank you.
So if you can have a healthy relationship with porn and you have a very unhealthy relationship with porn, how can you tell the difference, Nick?
Well, I guess it's all in the way that you are consuming it. If you're finding you have to have it, I mean, let's think of porn like a drug or a user. There's that craving. The craving for it is usually the most obvious sign. You know, of course, we always have this, that'd be nice. But if it's like doesn't overtake you where you can't stop thinking about it, or you can't wait to get home from work to put it on, and those cravings are getting stronger and stronger, that's probably the start of it. And I think if you're doing it daily or multiple daily, I mean, already that's got to tell you there's something going on there. Mood swings, like if you were to take their phone or their computers away, or they couldn't get access for any reason, you would definitely see the irritability or the mood swings around that, because
withdrawal symptoms, basically.
Exactly, just like a drug, they are needing that fix, because what's happening in the brain is this dopamine cycle. So you need more and more porn, harder and more graphic porn. So if
slippery slope.
Exactly. So if you start taking the porn away and that dopamine is dropping, you know, you're going to experience those drops in moods. Another sign is relationships. You start to lose your libido and natural drive for your partner. The only thing that really turns you on is what you're viewing. So you're starting to really check out of the relationship. A lot of the time it's around, this now builds the shame cycle, because we now have dishonesty and secrecy, and that's putting a bigger and bigger wedge between the couple. I've also and this is proven scientifically, there is this trend to go towards more violent porn once your everyday or bizarre has lost its effect, because the brain is a novelty-seeking organ. It's always looking for something different.
Good point, yeah.
Violence actually exists in the same part of the brain as sexual desire, interestingly enough.
Really?
So that's why aggressiveness can also turn on a man. So he'll go for more, BDSM types things, maybe more humiliation.
Yeah, there's a difference between a slap on the bum as opposed to choking someone. Yeah.
So it can go down some pretty dark. And again, no judgment if you're okay and it's not hurting anyone. If you can watch it discerningly, sure. But if this now becomes your thing, maybe you're even trying to get your partner to do these acts, you can see the porn is now ruling your life. You're the slave, not the master anymore. It can affect, time, things that you should be doing. You're timeless, this sense of timelessness. Hours go by and you've been on there for, hours when you should have been doing other things. Yep. Financially, if you're signing up to some of these channels or camming, it can be, sort of almost like a gambling addiction. You're now financially starting to suffer as well. So it can impact actually every part of a man's life. Maybe you're now starting to get depressed or anxious or low self-esteem, that you have to rely on this. So mental health starts to get affected as well. Yeah,
because I suppose if guys are addicted, they could be addicted to porn, probably have a few OnlyFans accounts, all that kind of thing. Yeah.
Yeah.
It just gets from bad to worse.
Yeah. So I guess there's some of the signs. If you can't put it away for a week or 2 weeks or a month,
then you got a problem.
Yeah, I mean, it's a very generalized statement, but but if
makes sense. I mean, it's like alcohol, it's like drugs, it's like anything, isn't it? Really?
Exactly.
Yeah. Okay.
Yeah.
So a lot of our patients do come to us with complaints about that, and they need it fixed, and they're looking for strategies to get over the porn addiction. What strategies? How do you attack that? What strategies do you implement with them?
Yeah, sure, James. Well, I guess one of the main issues here is that secrecy and shame. Now, when I send out my questionnaires, I write, one of my questions is not do you use porn, but how often do you use porn? Because
that's a telltale sign.
But also it's pretty. There's not a lot of guys who are not using it. So I'm not even going to ask, do you? I'm just going to ask you how often. That opens up the conversation. And to be honest, sometimes I feel like a priest, that I'm the first person who they have told this deep, shameful, I guess, secrets to. So once we actually even acknowledge that it has, or they have the awareness that now it is a problem, because some of them still believe it's not. When we have that whole conversation around it,
it's like an aha moment for them.
It really is. It really is.
Yeah.
So the number one thing of treating it is first acknowledging it. Well, actually, Nick, I thought it could be this, why I'm losing my erections, but I didn't have anyone to talk to. Now that we've talked about it, it is actually what I've thought all along. So that to them alone is almost half the battle. They have this sense of relief, and they've been able to share it.
I suppose that motivates them to stop watching it for a while at least, doesn't it?
Some, again, depending if they're hardwired, we've got a really hard battle because, we're really dealing with some very deep patterns versus, I know it's not helping. Thanks, Nick, you're right. I'm going to give it a rest. Okay, they're the easy ones.
Yeah, but otherwise it's like a long-term smoker who's trying to give up smoking.
Yeah,
but they might try 6 attempts and
exactly
be successful.
And some can go cold turkey. I mean, some just need the realization and almost the permission or the secrets out, and then they go, yep, done. Sometimes, again, individual cases. It depends on the type of porn, how long, why, etc. So
but perhaps youngsters think it's normal to watch porn, but it actually isn't,
So the first thing is actually talking about it, seeing where they're at. If it's a deep-seated addiction, I go into a lot of written exercises that they have to do for homework around how is porn affecting them in their life. They have to look at every area of their life. They have to look at how it's negatively impacting them.
So it affects all different parts of their life, does it?
Correct.
Give me some examples.
Yeah, so as I said, it could be financial. Their relationship is on the brink of divorce.
Yes.
They're a churchgoer, so they're dealing spiritually with guilt.
Yeah.
So that's up to them to come up with as many reasons, because we need a why. Without a why, if your why isn't big enough, you're not going to do anything.
Not going to stop doing it,
Yeah, so we have to start bridging that gap of, we have to get motivation strong enough.
So the homework is writing down all the different parts of their life it's very good.
So then we go over that. And also this comes around identity. Who is the man, father, potential father, husband, member of community that you want to be? And how does that align with your values, exactly. So it's a values exercise. So if you pride yourself on being an honest man, yet you every night
jerk
you
off
lock yourself away and tell your wife you're working, is this but again, you see how we're dealing with awareness until they start to go, well, actually, I didn't think of it like that.
Yeah.
I'm not being so honest, am I? So there's a lot of that. Then we put firm strategies in place, whether they need porn blockers.
What's a porn blocker? Just putting parent locks on phones and things like that?
Pretty much giving someone else that they trust, like the, what do you call it, the PIN or the code, so they can't unlock it. But let's be honest, if you really want to hack back into your phone, you can do it. But
if you create barriers, it's more helpful,
Yeah, so again, we're creating space that gives them, instead of just going click phone, they have to go, fuck, I buried the PIN code in the backyard. Now I'm going to have to dig it up and
go against what I plan to do. And
gives you more time to think, do I really want to go? Okay, we're buying time and space for mindfulness to make a different decision. New neural pathways again.
Yeah.
Okay. To-do lists. Okay. So I get them to come up with 10 different strategies when the craving comes up. That can be anything from calling mum. That's a good one to stop.
Yeah.
You know?
It's a sex killer.
Yeah, exactly. To exercising, breathing, 10 push-ups, 10 sit-ups, sit and breathe for 2 minutes, do a couple of rounds.
Then that's a new pattern that helps them on their way. Yeah, helps them beat the addiction.
Yeah. So some of it is distraction, which can be helpful. Like if it's in the middle of the day, of course, you can get up and go to the gym, or you can you can do whatever. But sometimes if it's the middle of the night and you're craving it, we want to go into the feeling. We don't want to distract because the craving will come back. So this is where sitting in that craving and really breathing, doing some deep breathing, some relaxation with an app or a breathing exercise I give them to really feel that craving, because it will pass, and not to give into it. Also, plugging back into the relationship, start giving them strategies to work on the relationship, maybe, some date nights, some fun things to bring some romance and magic. And why are you doing the porn in the first place? What is missing sexually in the relationship? So you can see it's multifaceted depending on what stage of the addiction they're at. And I always say there is no failure. There's only feedback. Like if you do relapse, please take note of that and bring it back to me for our next session. Because
it's like a cheat meal. It's not a cheat day. It's a cheat meal, and don't beat yourself up too much. Yeah.
Also, but it's going to give me a clue on what happened. Did you just get sacked from your job? Did you have a trigger in your relationship? Did you feel shit about your body? And so to make you feel good, that's key to finding out, why are we using the porn in the first place?
Yeah. Is it an addiction to the orgasm, or what is it? Yeah.
Yeah. Or is it a stress response? Like, people overeat when they're sad.
Yeah.
People use porn to escape their problems. So what's the problem that triggered the porn? You see how we go deeper and deeper. It's not just go for a run. We have to look at why the trigger was there in the
re-engineering
first place.
those pathways, breaking the patterns. Yeah, makes a lot of sense.
So, there is a lot that we can do around that.
Great. Okay. And so when guys come to the Men's Health Clinic, obviously it's multidisciplinary what we do, and so there's various different departments and experts that sort of help them along the way. But I notice what you do, Nick, when you're doing the therapy with them, the sex therapy with them, you're communicating with the nutritionist, you're communicating with the psychologist, etc., and you're going into different pockets of the business, because it's kind of a team effort. What do you think about that? That seems like a great strategy to me.
Yeah, because one of the key points of giving up porn is also letting them understand that it's not going to be easy, okay? So
they're going to feel bad.
You're going to feel shit. This is like giving up a drug.
Yeah.
So we want to start preparing you. And also as a personal trainer from a health perspective, I also have the information that, let's also start to get a little bit of a care plan in place. As you said, we have a nutritionist on board. Let's start looking at your diet, your sleep patterns. Do you have an exercise program in place? We want to start getting you to feel good in all these other areas, because the moods and the cravings are going to come on. If you are feeling better about what you ate or you got to the gym, that's going to help build that resolve and confidence and feeling good when you're having a really hard day and mentally fighting those cravings.
When you're aware of all those different sort of parts about yourself, it's going to help you, isn't it, to give up the addiction? Yeah, makes
so the healthier
sense.
You can feel outside of the porn, and the better it gives you an avenue to start realizing there is actually more to life and more to porn as well. And these guys start to feel great if they haven't been to the gym before and now they've got an exercise program, Do
you ever find patients that have a porn addiction, do they sort of, you obviously work with them, do they still watch a little bit of porn at the end, or do they completely go, not watch it anymore, or is it everyone different?
I would say the majority do give it up completely.
Yeah.
Okay, because the majority
they get it from their partner. They get the fun times and the lovely nights and with their partner instead of watching a reel or what have you. Yeah.
And they don't want to go back down that slippery slope. They realize it is a very easy,
dangerous slope. Yeah.
Back straight into it. They don't want to undo all their hard work.
Good for them.
As I said, the 30-year-old guys, what I've also seen, which is beautiful, is that reconnection of their partner. So
it's lovely.
They don't need it anyway.
So good.
Or they've been single, and once we've got them off the porn, suddenly love comes into their life, and they've met a girl, and they're having sex either for the first time, they were virgins, or they're experiencing sex as a virgin.
Because if they go through a period of time where they're not watching it, they've broken that addiction, then it becomes exciting again.
It really does.
Yeah.
Yep.
Excellent.
But not many of them go back to it because they just know that it's, once you have your eyes opened, you realize it is what it is.
Especially if you realize you can get hard without it. Why would you go back to it and risk erectile dysfunction again? Yeah.
Exactly.
That's the learning they go through.
Yeah.
Makes a lot of sense. Thank you. When it comes to performance anxiety, how do you determine why the guy is losing his erection? Yeah,
that's a good question, James. So I use a little bit of a protocol where it's kind of a 3-step question where I say, well, first of all, number one is they need to have seen a doctor or a urologist to make sure that it's not a physical problem, okay? So that kind of goes without saying within the clinic. So we've ruled that out. Now, step 2 is I ask them to masturbate watching porn, okay, just to have that experience. In step 3, I ask them to masturbate without any porn, without any fantasy, okay? Now, a healthy young male will be able to have
brain thoughts.
Well, he'll be able to get an erection, he'll be able to masturbate, and he'll be able to ejaculate, in a relatively normal time frame and ease of doing it, okay? If they can watch porn in number 2, but they can't lay on a bed and just masturbate without it, they've clearly got porn-induced erectile dysfunction. If they can quite comfortably do number 3, masturbate alone, but once they're in the bedroom with their partner, they lose it. It's a performance anxiety. It's about being with someone else because quite alone, they're quite able.
And then you understand how to treat them.
Correct. That kind of puts it, and again, without pigeonholing, but we've got to start some sort of sorting process, and then we refine the questions and what else is going on. So
you can really pinpoint what's going on.
But that's a very good way of saying it. If they can't, and I do ask that quite often, because when they say, I masturbate 3 times a week, I say, do you ever actually masturbate without porn? And they're just like, look at me like I'm crazy.
Yeah,
it's like,
I can imagine.
No.
Yeah.
Could you? Actually, I don't know. I don't think I could.
Yeah.
So
whereas us older people couldn't make. If you can get back to the hedge, then you had to.
Exactly. So again, depending on the age group already, if a guy is presenting before I've even spoken, without too much assumption, if he's 22 years old, I can almost guarantee he's got a porn addiction because what 22-year-old
makes sense. Yeah.
Doesn't really.
It's right there at their fingertips. Yeah. And that's a wrap for today's episode of Between the Sheets. Thanks for joining us. If you're enjoying this podcast, give it a like and subscribe so we can keep creating content you'll love. Check out the description below for links to our Facebook and Instagram pages to get more updates about Men's Health Clinic. And if you're experiencing any bedroom health issues, please feel free to book an appointment with us through the booking links provided. If you have questions or want to start your treatment for sexual dysfunctions, reach out to Men's Health Clinic. We offer free online consultation and provide custom treatments. Take care, everyone, and keep the conversation going between the sheets.